people in positions of power, people at the NIH, for example, who are responsible for funding science, basically made it clear that they wanted a needle in every arm, and that any discussion of things like natural immunity or potential adverse effects of the vaccine was going to be forbidden. It's just not something that you could talk about publicly. So there was this, from the beginning, there was this lack of transparency and an attempt to control people's behavior by only giving information that we thought would encourage vaccination and never mentioning things, even true basic scientific facts that might discourage vaccination. And I talk about in my forthcoming book called The New Abnormal, I talk about this problem with transparency. The federal agency that approves medications and vaccines, the FDA, was required on the day that they approved the Pfizer vaccine to release all the clinical trials data. They didn't do that. So I, along with some fellow scientists, had to file a FOIA request, a Freedom of Information suit against the FDA to get that data released. The FDA came back and said, we'll give you 500 pages a month, which, if you do the math, would have taken 75 years to release the data that they reviewed in 108 days. The FDA shockingly also requested that the company, Pfizer, be allowed to redact the data before it was released. The judge said no to both of those things and said, you've got to release it in the next 8 months. We've got a couple of months to go on that. So basically, we're still in a position, Jimmy, where thousands of people like me lost our jobs for declining a novel injection whose safety and efficacy data still remains hidden from full public scrutiny and full independent analysis, which should be concerning to Americans. This goes back to that issue of informed consent. You can't have informed consent if you're not informed, if you don't have all the information available.
So, and you know what, a very popular phrase during COVID came up through the culture. I'm sure it was thought up in a think tank sponsored by Big Pharma, but the phrase is, please don't tell me you're doing your own research. People would say that, and I have to remind people, before COVID, when they would say doing your own research used to just be called reading. And
yeah, that's right.
Now they're shaming people for reading and getting informed about an experimental medical procedure, and that doesn't set off any warning bells in anybody's heads. Even comedians, who are supposed to be the biggest skeptics in the world, they just repeat that. They say, please don't do your own research, as if that's some kind of smart thing to say. That's actually anti-intellectual in the extreme, as you wag your finger at someone else for wanting to read. I'm sorry, I'm talking too much, but I just want to show people.
No, absolutely 100%. That is such a good point, because this was an example, not just of anti-intellectualism, but of the condescension that was showed to the American people. You all are too dumb to go find sources of information, to assess sources of information, and to make your own healthcare decisions for yourself and for your child. So you just need to shut up and do what you're told to do. And even if with your own eyes and your own experience and your own senses, you talk to people or you encounter difficulties with what we're telling you to do, you see the harms of lockdown and school closures on the mental health of your children. Well, you're supposed to ignore your senses and your instincts as a parent and everything that you're observing and just shut up and do what you're told. You're not supposed to go online and see that, oh my gosh, there are studies showing that during lockdowns, rates of depression tripled, rates of anxiety disorders quadrupled, drug overdoses and alcohol-related deaths shot up by 30%. All that information is available for those who care to look. That information, by the way, was published in the CDC's own journal. But no, Americans who are questioning lockdowns need to be silenced or kicked off social media or shoved off their YouTube platform, because they just need to do what they're told by their superiors. Well, I mean, this is, first of all, completely un-American. It's totally antithetical to democracy. It's condescending. And, to their credit, there's a lot of Americans now that are waking up, both on the left and on the right, and starting to ask questions and starting to exercise their own judgment and critical scrutiny now. And I think that's a very good thing. I think that's exactly what they need. And I appreciate you and the others who have been willing to go out there publicly and sort of scratch your head and say, hey, wait a minute. I'm not sure about this. This isn't adding up, right? Your listeners may not be an epidemiologist. They may not be a virologist, but they are in possession of common sense. They're in possession of logic. They can see a manifest contradiction, and to shut off that part of your mind is not going to be conducive to your health, and it's not going to be conducive to social functioning and human flourishing. That's how people operate basically in a totalitarian society.